Tommy Shepherd.
Thank you. Last year in Scotland, 934 people died through drugs-related methods. 137 of them were in Lothian, which covers my own constituency in Edinburgh. This year, people fear that in 2018 that figure could top 1,000. So people are right to regard this as a crisis that needs to be addressed. But the compelling tragedy of these deaths is that most of them were avoidable. These people didn't die because they overdosed. They died because they were using dirty needles or other paraphernalia, and they contracted hepatitis C or HIV from other users. They died because the stuff they were taking was either cut with toxic substances or was far more powerful than they actually knew that it was likely to be. And they died in some cases because they left treatment too early, because the orthodoxy is that success is judged by how many people you get through treatment rather than the number of people you keep in treatment. I have spoken, and I laud the work of agencies and many sincere individuals on the ground at the front line of this, and I've spoken to a lot of them in recent months, and they all tell me that even without changing the law, much of these deaths are preventable. We could certainly, as people have talked about, have safe consumption facilities. We could also have heroin-assisted treatment, because the reality is that the best way to get somebody off an addiction is, first of all, to manage it so that they can regain some control over their lives and begin to make plans. We could also remove the stigma, because there are far too many people in our society who regard these deaths as, oh, they're only junkies, their lives don't really matter. We have to say that these people were once and could be again valued members of this community, and we need to reach out to them. And finally, we could shift the emphasis onto harm reduction with a massive publicity programme. Mr Moon, I don't have time to say what I wanted to say, so let me just make an appeal to the Minister that there is cross-party concern and cross-party support for a new initiative now from the Home Office to review the Misuse of Drugs Act 1971. There is no other area of public policy that we deal with where the principal legislation has remained unchanged for nearly half a century, especially when the problem has dramatically got worse and the character of the problem has changed. And far too many people are labouring under the misapprehension that prohibition means control. It doesn't. There is no control over what substances come onto our streets. There is no control over how much of it is available, and there is no control over who is using it. There ought to be, and we have a responsibility as legislators to try and move forward and achieve that, so a review is long overdue, and I implore the Minister to at least be receptive to these appeals.
Paul Sweeney.